Yeah, we need to, like, what angles are we giving here?
Well, you're live now.
Great, that's okay.
You're
though.
giving great angles. You all look awesome.
Do we look amazing? That's
Am I in the
main
shot?
thing.
Yes.
Oh, that's too bad.
We're all in the shot. Should we give a couple of minutes for people to decide to come on?
I mean,
Do the thing.
there's apparently 2 viewers right now.
Is it Mila and Georgia?
Well, it won't tell me that.
It's Mila and Jenny.
Well, we can chill for a minute then. Password?
Don't say it all.
I'm gonna mute.
Let's just do it because it's.
Unmute it. We're doing it.
Go.
Yeah.
Okay, are we good? Hi, everybody. Welcome back. It's been quite some time since last we spoke. But we're here today because why the hell not? I think we'll just kind of get started the way we usually do by saying who we are, why we're here. We're all feeling a certain type of way about this week and some of the things that have happened. So, you know, we call it CovidConvos, but it might just lean a slight different direction today. So I think we'll just go from there. I don't know, who wants to start? Do you want to start? Who are you?
Hi, I'm Levi. I am the executive director at Sunshine House. I've been in all the magazines. I've been in all the papers. Quite the scandal, really. We haven't done this for what?
Like over a year.
Over a year, yeah.
Yeah.
Lots of things have changed. We have a drug ban that you might know about. We got our FTIR machine and we tested it out this week, and that's super exciting.
Just so folks know, the FTR machine is basically a drug checking laser to check people's drugs.
Yeah, and it should be operational on the RV next week.
And it's basically like they give you like a library of codes to figure out what substances are in it, and then you check it.
Yeah, I think there's 30,000 chemical compounds in the library.
Yeah, and you don't even have to waste your drugs. Like you check it and then you get your drugs back.
Depends.
Mostly.
Mm-hmm. You're not wasting a huge supply. You're wasting less than you are on the test strips.
Perfect.
If there's any waste at all.
Yeah, love that. Love that for us.
It's great.
We're in Prairie. We got to make sure we, maximize our business.
Oh yeah.
Yeah.
What else are we doing around Sunshine House? Lots of things. Great things. We had a queer bingo on Sunday. It was our second busiest bingo ever. So.
Oh my gosh.
Yeah. Weird. Thanks for your constant support. I'll see you in the magazines.
Are we going in order here?
I think we should.
Okay. Well, I'm Marcia Anderson. I am a former medical officer of health, and I've been in no magazines, but many academic medical journals. And since I quit my job in public health, my government job in public health, some other folks around the table had to tell me what's going on with COVID for the first time. That's all I'm saying.
I'm Karen, and I work by day in human rights, and
By night.
by night, by night, and no, not by night, nowhere in my own home.
You're a quilter.
But I do quilt, and I do organizing with QPOC, and do some work with women's health clinics.
My name is Uzoma Asaguera. I do use gender neutral they them pronouns. I am by background, a registered psychiatric nurse and an addiction specialist. I'm a community organizer and activist, specifically around creating safer spaces for queer, trans, Black, Indigenous, and people of color in Winnipeg and surrounding areas. I'm also the NDP MLA for Union Station, which is primarily downtown Winnipeg, and I'm the critic for healthcare.
I'm Margaret, and I'm a nurse.
Pause.
I just like to give people a minute to be like, that's who that is. And I'm like slightly distracted. I didn't even remember to put lipstick on because Marsha's kids and my kid are upstairs, probably writing mean things underneath this live, because that was their goal for the evening.
Someone said hello.
Oh, well,
that's
that
it
might-
so far.
That's good. That's a good start. So I'm here, I don't know what to say, like, I work in harm reduction, I love drugs and I love sex all around. And I'm really feeling the burn this week from some of the nonsense that's come out of the province. And so I wanted to have a little bit of chatting about that. And I also, like, I feel like it's been a long time and like people have been up to some fun things. Like I feel like there's stuff happening out there. So hopefully we can talk about that. If folks have any questions or comments or like want to tell us that we're looking good despite a 3-year, round of pandemic and long COVID features, then that would be super swell. And I don't know, I think we'll just chat, hey? Like, we're gonna talk a little bit about COVID because while the world thinks COVID is over, we know that there's still lots kind of going on. And also we don't wanna like get into a spot where we're like leaving folks kind of in the dust around how we can be out in the world and safe as possible and also taking care of each other. So I don't know, does anyone want to like chat about what it's been like or where you guys have been at or what the things that have been happening for folks have been lately around this?
Well, okay, I will start and say that
Use your outdoor voice.
my outdoor voice.
Yeah, we're working on a projection moment.
No, that's just my voice. Yeah.
All the throat clearing, I
That's
was
just how they
wondering.
talk.
Okay, maybe I can help myself out here. So COVID is obviously still very much an issue in our communities. I think that there are a number of people, and I think understandably for some people, the notion or narrative that COVID is over, there are a lot of folks who want to embrace that because the pandemic has been very traumatic, it's been very hard, and I can understand and appreciate why people want to leave that behind. But the reality is that COVID is still very much in our communities. It's still very much having a negative impact on folks of all ages in our communities, and especially those who are immunocompromised and more vulnerable to having some negative outcomes if they get COVID. So for me, I think it's really important to be responsible about the ways we talk about COVID and to ensure that when we are talking about how we move forward from the more acute stages of the pandemic that we've all navigated, that we're moving forward in a way that recognizes that there's still risk for a lot of people and that it's still having an impact. I think that's the responsible way that we can approach where we're at right now. And so, obviously I'm curious to hear what other folks
Me
have to say
too,
about
yeah.
that.
What do you guys say, where are you been at?
Well, I did look up the data, so.
Bless your heart, Marsha.
Yeah. And I mean, our data is nowhere near as good as it was during the height of the pandemic, where we could give really accurate daily counts and really good pictures of what was going on. We can get a sense of trends, right? So this data is almost about 2 weeks old. So it's saying some increased activity, but just to give people a sense, it says the average daily specimens were about 200, so 200 tests going through CADM. Whereas, at peak times, we were hitting thousands, right?
Yeah.
And everyone who had symptoms was getting tested. That has really shifted a lot. That gives us a sense of what the undercount might be, right? So most of the people who are going now are people who might be interested in treatment or because they're at higher risk for severe illness or because they're going to the hospital. So hospital admissions down from the previous week, but still higher from earlier in this year. It says there were 59 people in hospital with COVID and 8 admissions. That was, the kind of first week in March. And I think it's important to pay attention to some of the other viruses like flu, and according to that data, severe flu is really down too. I think one thing that I would want people to know is even though vaccine uptake really plummeted for 3rd and 4th doses, those first 2 doses where we had really good uptake, particularly in Black and racialized communities and First Nations communities, on reserves and some urban Indigenous communities, those first 2 doses have really protected against severe outcomes, even when we saw very high burdens of COVID virus circulating in the community. I think that just really emphasizes the importance of the vaccine, even when it's not reducing transmission and protecting people from severe outcomes. That's a really important and solid public health outcome.
And so what about the rest of you guys? Or like even like Marcia, you too, like what are you doing? Like what does it look like for you in your lives to like what does the balance look like? Like what is it? Like I can say for me, I am still pretty cautious and I'm pretty much like still masked in large indoor public gatherings, like on the regular. Some stuff I'm just not quite ready to do. And but I'm also kind of like, I'm the only one masked, like, is that theater? Like, are we actually, it's a little bit of theater, right? And so then I'm like, so what is the work now? And part of me is like, this is why when we were having these conversations before, we were like, why are we not talking ventilation? Why are we not talking like freaking air circulation and all of that stuff? Because our organizations, especially small ones, are certainly not like, we don't have the like HVAC system of like across the board, for example. It's just that like game cafe. I had somebody tell me that they had their little like CO2 monitor and the like cycling through the numbers. Like that's a good place to go, y'all, apparently, according to the little like scientist people that I know who are doing that. But like, what are folks like? What are you doing? How are we doing this stuff?
We're pretty similar. Like we are like, well, obviously we're in a 105-year-old building here, so like installing HVAC systems that can do that are obviously quite costly and difficult. But we have done things like Rowan was able to procure some really good air filters, so we have those running all the time. We were also really fortunate that we had those 2 PCR testing machines, so the staff still test every 2 weeks, every 2 times a week. And then anytime that we have anyone test positive, they still get the same treatment that we got at the beginning of the pandemic. So even if you don't have sick time, we're still paying people off because that's a preventative thing. Like, because we'd much rather be able to catch, and anyone who's symptomatic has to test. That's just the rule. And for myself personally, like I'm obviously engaging in much riskier behaviors in March of 2023 than I was in March of 2021 or 2020. But knowing that I have 5 vaccines and also that I have access, because we're really lucky because I have access to the PCR testing, really, really helps me. So if I'm going to visit my mom, or if I'm going to go do a show this weekend, like I'll come in and I'll do a test, and I'll do those types of things to make sure that it's catching that proactively. So the best that I can do myself individually and as an organization is prevention and still supporting people. And so even like if community members, so we still have the same things in place. So if community members are testing positive, we'll still do the same things that we were doing in April and May of 2020, like get them some food, go and see if they need to go somewhere. Luckily, the alternative isolation unit is still operating for the time being. And we can still put people into services, but people just aren't as eager to test anymore because if they are working, they don't get those same benefits.
That's right.
And so they're like, well, I'll just call it a flu and I'm gonna go to work because I have to. Take a day or 2 and then I have to go to work.
Yeah, I mean, we haven't done anything systemically to support people through this like next period, so we're in a bit of a bind. I love knowing that about the way, like having access to a PCR machine is like, I mean,
and it's not ours. Anyone can use it at any time. Like you can come in, we can show you how to do it. Anyone can come in and do it because 90% of the time, unless it's like the beginning of Sunday and Monday and the end of Wednesday, because that's everyone's typical schedule, it's just sitting there for people to come in and use.
Yeah.
And it takes 15 minutes tops.
Yeah, most of us have done one at this point, so we remember. But I think those kinds of things are important for people to know too, that there's things that people are doing, like people are mitigating risk, and I think that it's tricky to figure out what the right balance is. I think about it all the time. Like every time I'm out, and I think you guys, if you've been COVID convoing with us since the very beginning, Marcia and I talked a lot about what is one person wearing a mask, like what is that doing? And so I think I like to think about what else people are doing to figure out their business.
I'll just add to that, it really depends on the quality of the mask.
Yeah.
Right? Like if you're gonna wear a cloth poorly fitting mask and you're the only one wearing the mask, it's not honestly gonna be doing too much. But if you have a good fitting
Like a
N95 or KN95,
Yep.
properly around the nose and everything, that is gonna be offering you more protection than being unmasked, especially if you're not taking it off to eat or drink in a crowded place.
Yeah.
So there's a
range.
range that people can be making decisions about depending on what's accessible to them, like cost-wise or otherwise, as well as where they're going to be.
And so like, what are you guys, like, what else are you guys doing? Like, what do your lives look like in a year after our last COVID convo? Is it different? Is it like, are you doing more stuff? Is it, like, how's it feeling? How are you taking care?
I think, I definitely feel similarly like I'm engaging in much higher risk behavior now than I was, like March of 2021.
Can I just say though, yes, and like you said, the risk context has changed, both because of vaccination status of you personally. So it might seem like individual risk behavior is higher, but that's in a different risk context. That's really important to acknowledge.
Yeah, and that's a really good point. But I think, I think the big thing for me that came out of the pandemic was just like a fundamental reorienting of how I live my life to bring more awareness to, for example, the implications of me going out, which I don't do if I'm not feeling well, or who I'm going to be around, or the steps that I take prior to going out to, the club, to DJ, or to like fangirl you guys having a karaoke night, for example. So trying to bring more like consciousness and awareness to just really changing my behaviors. Like prior to 2020, if I had a cold, I still went places. Like it didn't necessarily alter my, but even if I had allergies, like I still went places. And now the minute that like I'm not feeling 100%, I'm trying to think about what the implications of that will be for the people around me. And so that has been a fundamental shift in my thinking about what like private versus public life means, and what my, personal decisions, the implications that they have for folks in my, immediate family and community, and trying to take those steps of like, okay, have I tested recently to make sure that like I'm not, asymptomatic, I'm up on vaccines, like I'm thinking about those kinds of things as well so that I can mitigate risk. But masks in public places has been a difficult one for me, and I've noticed myself slipping, and I've also had a hard time trying to navigate that at the club. Honestly, it's been a challenging thing. Like I'll be honest that that's not a practice that I've maintained, and I've wondered like when no one is masked at the club, what impact me being masked when I have been masked has had, and if being not masked in the DJ booth really has any sort of impact on like the safety of that context. So yeah, there's lots of question marks, I think, still about how to practice community care in these contexts in the absence of any broader conversations about what communal care looks like, or having systemic solutions to the fact that COVID is still a reality, and like maybe increasing a bit. I've heard of more cases in the last couple of weeks than I have in the last couple of months. So it's really tricky, and I think if folks at home are having trouble navigating, like if I'm not wearing a mask, am I like putting people at risk? Like should I wear a mask in this context but not? Like I don't think any of us should feel bad about that, because we're doing it in the absence of any information about how to navigate COVID in these times. So
Anybody else? I just think, I mean, it's true. I don't even have a good solution. I'm rarely doing things that aren't, like I'm mostly masking in crowded public places. That's sort of where I'm at this point. And I'm also vaxxed to the max, but I also am like, I got diabetes last year, and I got COVID, and I don't really want to get COVID again. It like kicked my freaking ass. And it was not like, and I can trace because of how intense I have been about it, I know how like, I know how COVID got into my house, and so, and it was not from a public, it was just from somebody who had a headache at my workplace, and like, we were socially distanced, and it was, but I got really sick, and so I'm gun shy about everything, and I also have lots of friends who are like immune compromised and or like have other chronic illness that feels like makes it tricky. So that's sort of where I'm at. It's like but I'm also like, I'm just unsure about what the best things to do are, because we're pretending like this isn't still a thing. And I find that to be the hardest part of like figuring stuff out, because it was a lot easier when, the world wasn't like in this weird moment of pretending things are happening. And also things are happening, like I also got the flu, like I just got everything. So, and the flu just felt like it was, I was vaccinated. I was like, oh, Marsha, I've been feeling sick for like 2 weeks. She was like, did you get your flu vaccine? I was like, yeah, it just sounds like the flu then. So, like we didn't, like I didn't read it as the flu. I was just like, this is just a real bad cold that won't go away, that's sitting in my chest. So, I think like that it's just a complicated, weird moment in time. I'm just gonna be really happy when we can all get filtered, like we were just talking about how like without air filtration, without like actually access to the things that people need, we're not gonna be able to do, we'll see. Anyway, I don't know what the answer is.
I think the other thing with this kind of fall and winter is we kind of saw for the first time how COVID and other respiratory viruses were going to impact the population. So the biggest concern actually wasn't COVID, it was RSV and kids, and that really strained the children's hospital, not just here, but across the country. And then kind of like with adults, when things got shut down because we could only do COVID care in hospital, that happened for our kids too, right? And so we saw all these different respiratory viruses circulating. And I don't know that we did a great job of living with them in a way that was good for our health system and good
for our kids,
for people. Yeah. So I think it's, it'll be a good moment, maybe in April and May out on the patio to reflect on what might we want to do differently next year. I think the thing I found most shocking and problematic and was just the number of people who are going in public spaces with symptoms. And I can understand because we have no structural or systemic support for many people to stay home when they're symptomatic. But the number of times we got sick where one of my kids were like, well, so-and-so was at school with a runny nose, or they were coughing all over the place, or well, not my kids would have done more hall, where one would think the likelihood of being able to stay home when sick might be higher than in some other circumstances. And so I think that's an important piece for reflection, is we're going to be living with a myriad of respiratory viruses. I don't know that anyone predicted RSV and the impact on kids would have been the worst that we saw this year, right? So what do we want to do differently from a policy perspective, from a public health perspective, from an individual community care perspective in the next respiratory virus season?
Totally. Yeah. Well, and our kids did such a good job of like following all of the sort of public health orders. Like they were masked, they did all kinds of stuff when their risk was lower. And like our intervention in schools when they were at risk was not adequate. Like our schools are not set up. They're not set up for social distancing. They're not set up for like it's like, and my kid goes to a super old ass school. Like it is not a thing. So
well, a lot of the illness that requires hospitalization is in toddlers and babies, which again, I think makes us have to ask, how are we supporting parents and families?
Yeah,
absolutely. Yeah, the implications of, I tend to go to policy often because so much of what we learned during this pandemic, you think we would reflect those learnings or, take those learnings and see that represented and reflected in policy. And unfortunately, we don't. And, and then we expect people, and I do think that, of course, there's a level of personal responsibility, but people are navigating systems and structures that, quite frankly, most often the best ways they can. They're getting up in the morning, they're doing the best that they can, and asking folks to do what they cannot do
Mhm.
is totally unfair and unrealistic. You know, asking
Yeah.
folks to keep their kids home when they're symptomatic, or to stay home themselves when they're symptomatic, is sometimes asking some people to choose between their kids having food.
Yeah.
Right?
Mhm.
And that's an unfair and unrealistic expectation to have on people when we don't have policies in place that allow them to stay home and earn an income and be paid when they're sick. That's just one of the many examples I know we all know about. So
Yeah.
I think that's one of the most disappointing things
Mhm.
at this stage of things, is that we don't actually have policies in place that represent that we've really learned the hard lessons from the pandemic.
Mhm.
And it sort of creates this frustrating situation where, do we really think that this isn't going to happen again? Like, do we really think that we're not going to be in a situation again where these policies are going to help protect people? That's ludicrous, because we saw it literally just happen with RSV in kids.
Yeah.
Yeah,
Right?
and we were fortunate, quote unquote, not to have to transfer kids between ICUs, but that happened in Ontario.
Yeah.
And every year pre-pandemic, our health system was impacted in ways where people did not receive all of the healthcare that they needed because of the impact of respiratory viruses. And so, you know, I always think about what are the health services we want and need to have available, and what is the role in healthy public policy in protecting our healthcare system so it can deliver the range of services that it needs.
Yep.
Seriously. I have a question here from somebody on the chat, which is just a flat out, like, so should we keep wearing masks? What's the tea?
So, you know, what I would say around that is, I think what we need is better guidance on when, where, what kind of mask, and what about you influences your risk of severe illness, right? Or the people around you of severe illness. And I think those are the factors that I would consider. I am thankful we're heading into spring. I need patio season to get here.
Barbecue season.
Yeah, barbecue season, those are tightly linked for me. And I think, you know, outdoor socializing, again, one of the things amazing about it is that mask question goes down a lot. But if I was someone who had more significant risk factors for severe illness, even when I was vaccinated, I was going to be a crowded indoor public place where I could not be reasonably assured that everyone there would be asymptomatic, I would probably wear a KN95 or something like that if I could access them. I think I like going to work at the university every day because we still have a mask mandate. I feel more comfortable going there than I do feel to going to almost any other public place. And there most of us wear level 3 medical masks or the equivalent. So it feels good, I'm gonna be honest, like it feels like a good and comfortable place to be where I'm not looking around constantly to see if someone is coughing or sniffling, so.
It's also about those other pieces too, right? I think that we've learned so much, and so many things became common practice. Washing our hands frequently, you know, sanitizing our hands frequently, physically distancing, not going into spaces when you're sick, maybe not shaking everybody's hands, you know what I mean? All of these things.
No hugging.
Yeah, I know some people were hugging.
The Scorpios in the room are pretty stoked about that, yeah.
We have to like be kind of tight together to fit into this camera frame, and it's making us all very uncomfortable.
But we also know, I will say that there's a certain level of comfort that I have because I know going into this, who I'm in this space with.
Yeah.
I know that people practice certain, you know, positive public health measures, and that makes me feel more comfortable. So I think it has to also be a larger conversation about, we learned all of these skills during the pandemic, and it's important that we continue to remind ourselves of that and practice them moving forward.
Yeah, and encourage like receiving your COVID vaccines, right?
Yeah.
Like, you know, we can't be hesitant about uptake of COVID vaccines.
Bivalence.
Yeah, and the bivalence.
Vaccinated.
The mask isn't the single thing that's gonna make the difference.
Yeah.
Get vaccinated.
Yeah, everyone go out and
Paid
get
sick
all
leave.
your vaccines.
Yes.
And what?
Paid sick
Have
leave.
paid sick.
Have paid sick leave,
Yeah.
oh my gosh, honestly.
Yeah, if you have influence in like the sphere where you work or like are doing organizing, like encourage approaches that you folks are modeling, which is giving people the ability to stay home if they don't feel well and work from home if even they have the, you know, most minor symptoms, and keeping up mask use and
Yeah.
when you're together, yeah.
Yeah, we still rapid test a lot at our house when people, because whatever, I live with a kid and they're, you know, gross and germy. And so we do that a lot, and I mask out in the world when I can, especially in the winter, like it feels like, and also I don't go anywhere, it's the other, so I'm not really the best person to like give a huge pile of info. When I'm at the grocery store, I try to mask. I don't know what to say. Should we leave it for now? Let's talk about something else.
Sure.
Like, are we gonna talk about how we're all enraged about this nonsense? Is that on the agenda for today, or do we need like a
What
more
nonsense?
Chiller?
What nonsense are you speaking of?
What could I even be talking about? It's hard to know. It's hard to
Okay,
know.
I'll just say, no one has ever said supervised consumption sites are the silver bullet.
No way.
No one has ever even said harm reduction is the silver bullet.
Like, I mean, if it was a silver bullet, we would all be very, very rich human beings right now. Like, we would have been like, we would have figured it out. We'd have solved all the problems that have been done. Like, if only watching somebody get high would solve all of the problems in the world. We'd be done. Yeah. So who wants to, like, does anyone?
The Sunshine House bill?
Yeah.
We'd like
Call
to-
it what it is.
It's commonly known as the Sunshine House Bill.
Bill 33.
Bill 33.
The Addiction Services Act.
Our fave, yeah, that's what it's called.
The addictions.
Agency.
It's the addictions something act. Actually, for some reason I'm blocking. I have it all on my phone. I have it in my bag.
We're all
I
trying
have-
to block it,
I have
honestly.
it on, I have it printed in multiple.
So Bill 33 was
Mhm.
introduced earlier this week, by a more recent and new minister, Minister Lacombe. And this bill, the PCs brought this bill forward, and their narrative was that this bill is being brought forward because organizations that are providing harm reduction services they all need to be licensed under provincial licensing. And that, and the other piece that's really important is their position on this and why they're bringing this bill forward is that essentially any organization that's doing harm reduction work, providing, you know, treatment services or anything around addictions should be provided with the clear objective of folks being in treatment, getting into treatment. Because this government says that they are a recovery-oriented government, and I really think they don't understand what recovery within the context of addictions actually means and what that actually looks like. But
Here we
that
are.
was the bill that was brought forward. And there's a number of reasons why it's concerning and problematic that they brought this forward
It is the
at
addiction.
the time that they did, with the intentions that they're being pretty, I think, transparent, quite frankly, about. And I'll leave my comments there for now.
I mean, the truth is, it was a smart way to frame this whole thing. They've been gunning for harm reduction services, in particular, the work that's happening out of Sunshine House since the beginning. Every chance they had to interrupt this work is what has happened, and this feels like a little extension of that. Guys under the cover of saying that, you know, we would open the door to these other harm reduction services when we know that is not the case. It's a pile of nonsense. So these are the things that are kind of happening in the world right now. Oh, there's company here as well. Levi, did you want, I don't know what to say about it, except for that we've got some work to do, basically.
Do I have feelings about this?
Do you have
bill?
feelings?
Do I have any feelings about this bill? It's gonna get me in the magazine.
I know, you'll
This is
be.
why I'm in the magazine. Scandal. No, so this bill, like after we got it and we saw it, so I think everything happened on Tuesday, right?
Yeah, it was
That
Tuesday.
was only 2 days.
It was
ago.
only 2 days ago.
Only 2 days.
Feels like many days.
So first, we were aware of the op-ed. Somebody made us aware of the op-ed written by the minister in the Winnipeg Free Press and Winnipeg Sun about this potential change, that they were framing it as a potential change, a potential shift in the way that they're going to approach supervised consumption sites and overdose prevention sites. And it was very that first was really insulting to the work that we do at Sunshine House. And also it should be really insulting to the work that anyone is doing in harm reduction, particularly because the minister framed this work around the mobile overdose prevention site. She called it fly by night, and then they frame it, and this has been my kind of ideological problem with the way that this government talks about people who use drugs, and they frame it as automatically anyone who uses drugs is unsafe. The end of story. So you're unsafe and you require help. Full stop. That's the end.
But a specific kind of help.
But a specific kind of help, and a specific kind of help that they get to regulate and that they get to dictate what that help looks like. And if you're not playing by their rules, you are a mess of a human being and you do not deserve services. The end.
Or to survive.
Or to survive. That's it. But they called it fly by. She called what we did fly by night, which was, to me, was one of the most insulting things, because what fly by night insinuates is that we didn't put any care or thought into what we're doing. And this is 5 years worth of labor started by many people, and it's longer than that.
Yeah.
Because anyone who's witnessed loss in this community in the last 30 years knows that people have been talking about supervised consumption sites in Winnipeg since the 2000s.
Easily.
Since the 2000s, but it never became more prominent than in the last 3 years when we just saw the influx. And the conversations began 5 years ago seriously about what is the landscape going to look like. 3 years ago, in 2019, so 4 years ago, we released the report. And in that report outlined very specific service delivery models that the community of people who use drugs wanted to see. They wanted to see supervised consumption sites, and they wanted to see mobile services for people who couldn't access supervised consumption sites. This is 5 years. And then, so we, during the pandemic, we're like, we know we are not going to open up a supervised consumption site. That is not Sunshine House's strengths. Why would we try to do that? What can we do? We can do an overdose prevention site. An overdose prevention site differs from a supervised consumption site because it's immediate, it's peer-led, and it draws, and it's temporary. We're a temporary service, and there's lots of things that everyone can learn from that kind of pilot project temporary thing. So when we were designing this, and we got the exemption, and we got the approval, we went back to the community, and Davey had established a community advisory circle made entirely of Indigenous elders and entirely of people who use drugs. And they determine where we go, they determine what we do, and so that's who directs us. So we're responsible to community, we're responsible to the people who are going to use our services, and then thirdly, what we're able to do in this project is we're able to help everybody else who's working in this sector say, hey, we have been to North End Women's Center, we have been to Ray, we have been to 9 Circles, we hang out at Main and Logan. This is the data we have from that time that allows us to say, this kind of service is what is necessary here.
Yeah.
So I can say with certainty, not going to be a surprise to anyone, I can say with certainty that at Main and Logan or within a 10-block radius, you need a brick and mortar site there.
Yeah.
It serves no purpose in the long term to the community for Sunshine House to be sitting there for 5 hours a day when somebody else should be doing that, and they should be running a supervised consumption site that has all the bells and whistles. That's great. You know what that does to us? That allows us to move into communities.
To be mobile.
Allows us to move into communities and neighborhoods where we know it's not going to work. And what also that allows us to do is it allows us to soften communities. Because as Jenny said to me today, the gap between Manitobans who are unaffected and affected by the loss of life because of drug use is shortening every day.
Yeah.
It's every day. And so people know that these things exist, these need to happen. And so if we're able to go into Transcona or St. James, that allows us to soften the community and talk to neighbors and be like, hi, you know this is happening in your community. Let's work together and let's figure out a solution that's going to work for your community. Maybe it looks like a brick and mortar site, or maybe it's us coming here 3 times a week so that everyone who's good, people can come and test their supply.
Can I speak to that for a second? Because I think that's such an important point that destigmatizes what it means to access this kind of healthcare. The reality of it is, and you've already said it, nobody is untouched by what folks are struggling with right now. It's in every community, it's in every neighborhood. Folks and their families and loved ones are struggling. And it is so important that we create opportunities for people to connect with those who can meet them where they're at, who can have that conversation without judgment, and ask, where are things for you? How can we help you? What's going on? What do you need? There's so many people in the communities that you just talked about who maybe will not go to the services where they are right now, who don't know who to reach out to talk to. But if somebody shows up in their neighborhood and extends that arm out to them, they're going to reach out and have that conversation. So I think that's so important and so invaluable, that the actual mobile aspect of what it is that you folks do, and the ways in which you're saying, if folks listen to what you're saying and respect the data that you're generously collecting and providing, that opens up so many more opportunities for you to get out in communities and make that healthcare more accessible.
Well,
one of the things that came out of all of our early conversations is like, everyone knows, like, because drug use happens all sorts of places, but it seems to happen in, I've been a part of several Facebook groups, whether it be from my First Nation community or from my home, from my family and stuff, where people are like, oh yeah, we've been collecting needles and stuff at the playground and stuff. You know who can pick those up? A nice supervised consumption site. You know who can be there? A few blocks away from a school or a playground, so people would have an opportunity to not have to use in those spaces. An overdose prevention site. So it's like there's the problem that I have with this bill, and the reason why I talk about it in this way is that this bill eliminates that entirely. This bill eliminates the opportunities for communities to develop responses that suit them. Because what this government is trying to do is they're trying to create a prescriptive service that is going to fit into a model that we know is fundamentally broken. A model that we know is rooted in racism, is rooted in white supremacy, and is rooted in hetero-Christian patriarchal values. And that is not what we're trying to do. If that works, if that model works for people, amazing. If people want to opt into it,
too, all the
that's
evidence
great.
shows acts rooted in those things have led to the most harm.
Yeah.
And
It's
the inequitable impacts, right? Most of the gaps in health, including in drug use harms and drug policy harms, I would say, are because of impacts of the Indian Act and compulsory residential school attendance, or the way the Public Health Act was written so that so many Indigenous peoples got taken to TB sanatoria, right? Or the impacts of the criminal justice system, or the CFS system. We don't have a reason to trust governments to make legislation that actually responds and serves our needs. And so when a bill from the start has an ideologic standpoint that is highly racist, like recovery-oriented language is, what we can predictably and reasonably expect is more racial violence and harm to Black and Indigenous people.
Yeah. And this bill, it's disappointing because, for all of the reasons you just articulated, but the bill being brought forward at this stage,
I know.
and if you get into the weeds of the bill, there's a lot in it that is so deeply concerning. But the idea that somehow bringing this bill forward is their way of saying, even if this bill were implemented, that's going to impact where things are at now, is nonsensical. It won't impact it in a positive way. The way that this bill is currently laid out, it'll have detrimental effects. But it's also so concerning that the government in that particular department spent all that time and energy
Oh my God.
developing this
Yeah.
bill in the midst of a crisis.
Yeah.
In the midst of a time where their decision to refuse to support evidence-backed efforts to save lives in our communities, they've taken no action. They refuse to support those who are taking meaningful, impactful action. And they spent all that time drafting and creating and bringing forward this piece of legislation instead of addressing the overdose crisis, the astronomical rates of HIV in our communities, the rates of the devastating rates of congenital syphilis in our communities. All of these things have skyrocketed under this government, directly tied to their inaction and harmful actions. And their response to that is this piece of legislation.
Which also is so absurd because they had a moment in time in 2020 when the federal government said we're going to be doing these urgent public health needs sites so that people can address, so communities can be responsive and address how they need. These are going to be the requirements for it. You can sign on, and each province and territory, or each province had the option of signing on and developing their own protocols and their own guidelines in conjunction with that actually expedites the processes for getting an exemption. The provincial government had that opportunity in 2020 and ignored it. And they could have opened that conversation at any given point from that day until Tuesday when they introduced this legislation. Until the urgent public health need. I think that ended on September 30th. That's why, actually, it ended on September 30th, which is why we had to fight so hard to get our thing in October. And so when they did all of that inaction, and then for them to turn around and pretend like this is some sort of productive conversation without having any conversation with us or with anyone who is planning on delivering these services is absolutely infuriating because and it's irresponsible and it's reckless.
And it's dangerous.
It's dangerous.
And let's be freaking clear, like they chose to target something like an overdose prevention site when we're not actually, like, even if that legislation was the most kick-ass piece of legislation ever, it's freaking 2 years out. So there's still no response to what's happening right now every single day. Like, we're in a catastrophe. We're in a drug poisoning catastrophe. And all they want to do is like try and figure out some weird regulations that may or may not come into effect in 2 years when we have, like, when our family members and friends are dying every day. It is completely disgusting and irresponsible. And it's not a good piece of legislation. It's not, like it's like a piece of, anyways, it's the worst. And so like trying to respond and figure out where to go next, which is why Levi's been on the magazines lately. Thinking about all of this work, I think, is really important. And I also, we were just talking too, like, the truth is the only difference between, organizations that have an overdose plan for their washrooms and the work that's like, and not there, I mean, there's many differences, but like we're just not watching people get high, but we still have a plan to respond to an overdose in different bathrooms, in different organizations all over the city.
And we still provide harm reduction supplies. So like, I think we need to be realistic, and I'm kind of wearing my community health hat right now. This will have huge implications for how we deliver services and how so many of us have been moving, to recognize the failings within our organizations and how we need to move forward and get harm reduction training and reorient the way that we use our spaces and open up our spaces to community and be responsive to community's needs. This will have massive implications.
Well, and we need organizations to say a thing. It should not be left to Sunshine House to be the ones who, this is a small organization that is not adequately resourced, and so how do we?
Well, look at the clothes Jude and I are wearing today.
I mean,
we're killing it over here.
I mean, the fashion is on fire over here. But you're small. Like, you're not a large organization.
I have an admin assistant who works 16 hours a week.
That's right.
But then works the other 20 hours a week on a month.
Well, and there,
You know,
exactly.
like-
And there's a lot of organizations who are doing, like, who need to speak up, actually. Because this is a really terrible bill and we need people to say a thing.
I think any organization that has recently implemented a plan around disrupting or dismantling racism
Absolutely.
in the healthcare sector
Yes.
should be speaking up, because this is a targeted action
Any
that
or-
will have huge implications, as you've noted.
Any organization that has ever put harm reduction on any application
Anything.
has a responsibility here to be
To say
challenging this.
Any organization that said the word reconciliation.
I think, all of what you folks are talking about is really important because, when we talk about who is most negatively impacted by systemic policies and those structures, we often talk about marginalized communities. And the other language that I use, and I know folks here use as well, is targeted people. And this is a good example of what we mean when we use that language of being targeted. That this government brought forward a bill. Again, if you really look at the content of the bill, there are many examples of who it is that's being targeted in that bill. It is not organizations that predominantly serve folks who come from higher socioeconomic statuses, maybe live in more affluent communities, maybe the populations that access those treatment centers or beds are mostly white communities who aren't dealing with systemic marginalization across every system you can name. So we have to be honest about who is being targeted by this particular piece of legislation and whose responsibility it actually is to speak up about that. Because now we have folks and we have groups that are mobilizing to come and address this bill being brought forward, to speak honestly about the impacts of this bill and why it's problematic. And those are the very same people who are targeted on a daily basis and who are navigating our communities with less resource and capacity than many others. And it's really incumbent on those who have access to more resources, who benefit from saying that they're doing the work of harm reduction and anti-racism and reconciliation, who disproportionately actually benefit from using that language. Now is the time to action what those groups have been talking about. You've got to do the heavy lifting right now because the government is depending on targeted groups to be the ones to have to find the energy and the time to push back against this, and that's not fair.
So sign up.
Well, and I think, there has to be about 10 steps back from this bill if we want legislation and policy that actually meets the goal of reducing overdose events, overdose deaths, harms from substance use,
And like just drug
HIV
poisons,
rates,
right?
all
Like,
those things.
like the toxic drugs.
When we come back to things like basic universal incomes, basic leave, safe Jose.
That's why I was so
reasonable
happy when they
shelter.
brought up Portugal.
I know, what else did Portugal do?
In 1996, they had a universal guaranteed income for
Yes.
everyone in the country. 5 years later, 65% of the people who were on the universal guaranteed income off of it. 2001, they
Yeah.
implemented decriminalization. They maintained
Possession for personal use.
of possession for personal use. They've maintained overdose prevention sites through these times because it's helped reduce their rates of HIV prevalence in the communities. It's like,
Yeah.
okay, fine.
Do that then.
Portugal's your model?
The
Let's go.
sweet of the
Let's
quality,
run.
Yeah, we're not cherry picking.
Yeah,
Sorry.
yeah. No, that's okay, but I think that was like the main
Yeah.
point, right? You can't pick the end of it, treatment. Like, we know this doesn't work in healthcare either. You only want to treat end-stage diabetes or stage 4 cancer, like, good luck with a sustainable health system that reduces mortality and meets people's healthcare needs, right? You have to have a whole suite that starts with the foundation of equitable and just public policy, a strong foundation of evidence-based public health, solid primary care that is community-based, and pathways into publicly funded, publicly administered, nonprofit treatment services when people are ready to access them.
Yeah, and that's premised on the dignity of people who
Yes.
use drugs. I mean, I think
Yes.
that's what's so harmful about this, is it's so premised on prejudice, stereotypes, and stigma around drug use. And that's really just not serving anyone.
And it's not serving anyone, it's so harmful, and we can't pretend, we know that stigma is a massive barrier to people getting into any sort of contact with the folks they need to address, their health concerns, their addictions, all of it. And, what we've seen for years with this government is this condemnation, this stigmatization of people who use drugs. And it is really so, it's rage inducing, but it's also heartbreaking. It really is, because to have such a massive platform and to use it in such a harmful way, again, in the midst of all of these raids, again, HIV, congenital syphilis, overdose, all of these things that are rapidly increasing under your watch. To not put those things together, to not see how they're connected, to me is a level of recklessness and irresponsibility that, we can no longer dance around. We have to be able to name it. And, we talked about the fact that this conversation around licensing is a conversation we could have,
Yes.
I would say
It's a conversation we could have.
Yeah.
But this isn't it.
No.
And unfortunately now, again, when we could be having a different conversation
Seriously.
that's actually productive, instead we're talking about a bad bill.
Yeah.
And I'm gonna be political now and say, a bad bill that right out of the gate, and I was really disappointed to see the Liberals also support.
too.
What?
And went out in the public and talked about how, anybody can just open up and is just doing these things, and that's not true.
It's not true.
Right? So, you've got a government who brings forward a bad bill, you've got a Liberal leader who comes out and automatically says like, this is okay.
Yeah.
It's not okay,
No,
actually.
it's not.
And that's part of the problem.
Yeah.
So people can definitely, to push back against this and to,
Totally.
But I don't
That's-
actually think it's political either, because it is really clear it is not evidence-based.
Yes.
It
Yeah.
is ideologic, and it doesn't meet the needs of the population
Yeah.
health crises that we are currently having.
And it didn't actually,
So-
like, nobody's responded to that letter we sent in October. There's 80 community health organizations signed on to a letter about like harm reduction investment and what needs to be done. And not a single one of us was consulted about this bill. Like that's, it's like, come on.
But a conversation around licensing could be around how do we structure resourcing
Oh,
and the
that would be nice.
participation of the community members who need the services and cultural safety in the services and in the pathways into care, as opposed to a bill that seeks to exert power over
Yes,
and
completely.
control.
yes.
Like, those are two fundamentally different approaches that will
Yeah.
result in very different
That's a good
outcomes.
But I think that's also true, because if we look at when you treat substance overuse, let's call it, or substance misuse, as a criminal issue, and we do this all the time every day in Winnipeg through the Intoxicated Persons Detention Act. So when we view that person's substance use as being a social problem that we have to treat, that person goes into the drug tank. We live with that, that's fine. But if you look at it, and then we look at supervised consumption sites, overdose prevention sites that are designed from a place of love and a place of care and a place of health. In Canada alone, since 2010, over 60 people have died in drug tanks. Not one person has died in a supervised consumption site or an overdose prevention site. Not one person. So if you tell me that if you're coming at it from a regulatory perspective and that's how you're going to deal with it, you're going to be dealing with debt.
Yeah.
You're going to be dealing with loss, and you are going to fuck this up immensely.
Yeah.
Sorry.
No sorry.
Unapologetic.
Incredibly.
Yeah.
Yeah, that story was a period, just for anyone watching.
This is our poster person.
I obviously have spent a lot of time and no sleep on this.
Some people have been reading some things. Like, we freaking know what we're goddamn doing, so like, we don't need weird, shitty bills.
Ideological, personal opinion based.
Like, we got other shit to do, y'all.
Yeah.
We're very pretty, this takes time. Like, we need to,
I had a dress I wanted to make for Panic Babes this weekend, it's not happening. So I'm like, I'm really pissed at you there, Miss.
and that's the op-ed from over here. listen, we're shortly after 8 because that's the kind of way we are.
I do want to mention one more thing about the heartbreak piece.
Yeah, you
So
have to.
Uzoma mentioned heartbreak, and I want people to like think about all of the work and the effort that all of these people who like, so the staff that work on MOPS and Davey who runs MOPS. So every single person that works on MOPS is a QT BIPOC person. Every single person that works there, that from every single expert who we pay every day to hang out with us and to tell us and to teach us the things that we need to know to provide services that make sense for people, to the drivers that go and pick it up every morning, to Davey who has to deal with this bullshit every day. Every single one of them. And so when I had to come in and I had to tell them on Tuesday afternoon they were getting ready for their staff meeting, oh yeah, the Minister for Community Health and Wellness had just introduced a bill that wants to make every single one of you obsolete because they don't view you as providing a service that's valuable. And you know how heartbreaking that is to tell people? Like, because under this bill, we would not be able to hire all of these people.
Yeah.
We would not be able to maintain all of those people on staff because they would have to be either a nurse or a social worker and it'd have to be medically supervised, which is none of us want to work in that environment and the community does not want to use in that environment.
That's right.
The other thing that's really important here is it's targeting queer people in a lot of harmful ways because it requires us to be delivering services to people and using their health card and their personal health information that lines up with that service. And we know how difficult that is because we've been providing ID services here for the last 2 years. We know how difficult and how arduous that process is for people to get. So you're putting us at an extreme disadvantage to be able to provide services to our communities in reasonable, loving ways.
And
Like-
such a disrespect of the capabilities and knowledge base of peers who, people who use drugs, who have been at the forefront of creating responses to the toxic drug supply in our city and province, and to take those folks out of a network of care and out of like positions of work that in a sector that they've built is just like the epitome of disrespect.
And the idea that that we know how racist it is in healthcare systems, like the idea that somehow if you have a nursing degree, you're going to be able to do something in a way that like it's not logical. Like it makes
Not
no
if you actually understand
Yeah.
this area of healthcare.
Yeah.
If you actually understand it, if you've actually done your homework, if you've actually built the relationships and had the conversations and educated yourself, and don't lead with your personal opinions, which is exactly what that minister has said they're doing, and your ideology, you would know that.
I'm done.
Enough white supremacy for one night.
So then what, like, do we want to just tee off? Are we done,
Can I give a couple of points, just things people can do?
Yeah, that's a good idea.
Yeah.
So-
That's a great idea.
And I don't have one positive thing that we
Okay.
can say about
Sure.
So if you
Yeah, okay.
have thoughts,
Fun.
feelings, perspectives, you want to have your voice heard on Bill 33, you can email and or call, write your local MLA, write the minister and let her know what you think about this. This bill, at some point, there's going to be an opportunity potentially to go to committee where you can actually talk about whether or not you're in favor or against this bill. And I think it's really important for people to show up and have your voice heard on this and let the government know why this is an issue. And let's, again, in the community.
And like, take your time.
Take
Take
your
your
time.
time when you're giving your presentation.
Yeah,
I'm
take your space, take your time.
gonna deliver harm reduction training and my opinion.
There you go.
I don't think they know how big my family is.
I know. Yeah,
We have a lot of talkers.
yeah. And come down, bring snacks.
And every organization that might be listening or have staff listening, like if you put pen to paper around harm reduction, included in your grant proposals or in your strategic plans over the last number of years, many of you have, I know. So now is the time to speak up around what harm reduction at a policy level looks like.
That's cool. Okay, so let's just what's one cool thing you guys have done in the last year?
So at the beginning, I have a good one.
Okay, good, go.
This is one of my favorite ones. So at the beginning of the year, around Christmas time, a number of us were like, let's try to go to the gym. And so we started the Gay Gym.
Oh,
It's
yeah.
called Gay, J-I-M.
They're bros now.
We're different, but there's like 14 of us that go to this Planet Fitness, which is there's like 14 of us. There's like no pressure, and we all were just like, hey, we're gonna go to the gym tonight, and you want to come? And so then it allows people to go to the gym with other queer people and just like queer up the space for a bit, but then also just like you have a little bit of accountability built in. You're like, yeah, this is
I like that.
so it's been really, really fun. And it really, so last night I was like, I had the day. So I went, Crow and I were leaving work here. And I was like, I'm gonna go to the gym tonight. And Crow's like, well, let's go. So we went at 10 o'clock at night, sort of thing, right? So it's really fun. And so I'm really, really thankful for all of my friends and everyone who's part of it.
That's awesome.
Oh my god, the Gay Gym.
We're doing like a merch thing with all that same drag, and we're gonna call it Gay Gym.
If it was easy to
So
go
now
to
we're
the
great, right?
gym, I'd be there a lot more.
Yeah.
You really have at the gym in every other city, so why can't we just be gay in our gyms, you know? That's the best. Who wants to go next? Anyway?
I'm gonna go right back to the start. The best thing I did the past year was quit my job as an MOA.
Yay for quitting. We love a quitting moment here.
And I think the introduction of this bill reinforced that. And to be clear, part of the reason I needed to quit was because I would have said the same things. And I would have been targeted inside the system as well as outside of the system. And now I can drop one of those and not carry the weight of that inside the system and wait and see how my public health colleagues will be stepping up.
I love quitting Marsha.
It was a nice turn.
I'm like so into it. Quit your jobs, everybody.
Forget quiet quitting, do it loud.
Yeah.
Maybe, but
Do
I
any
did
staff
have
that
other
are
options.
watching?
Yeah. She's still working, y'all. Karen.
Okay, well, I have a little queer nibbling in my life who walked their first ball, thanks to Jude from supporting in the background.
Thanks to me, they did it like all themselves. It was absolutely
So
insane.
helping them walk in their first ball was kind of a real highlight for me.
Oh.
And I don't know, I'm just like still at home making all my own clothes.
Karen's homesteading.
I'm fully homesteading.
Like queer homesteading. Yeah.
Yeah.
Queer nibbling.
Yeah, I have skiing. It was kind of dropped off. I messed up. I jacked up my knees this winter, unfortunately. Yeah, I've got a little guy, a little baby in my life, and that like makes me so happy. I can't even properly communicate it. So when I'm having those frustrating moments, even today in the chamber. He sat up by himself, like he's sitting unassisted, and you know what I'm talking about. I don't want to like reenact what he did. But he did that for the first time, and I have a video of it, and so I'm watching it over and over, and it really, I'm so grateful to be able to be in a position to have a young baby in my life in that way.
Oh, it's the best.
Yeah.
It's good. That's every time we like see you on TV in the chamber looking at something, we'll be like, oh.
It's
You checking out your nephew? Yeah. I mean, we do. We have to do to get through the day. There's lots of things in my life, but the one thing that like brought me light this week was the launch of the Harm Reduction Network's Peer Voices video. So it's like all about, it's like folks who like just talking about what they want the work to look like. And it was real freaking sweet, actually. And it was nice to hear people's voices that I know talking about how they take care of each other. And anyways, it's on YouTube. It's called Peer Voices. It's the Harm Reduction Network's little video. And it was like a very well-timed public launch for me because it changed the direction of things. So that's my joy.
You got a comment right away. That video was awesome.
Oh yeah, it's good. And even if you don't know the people on there, like you're just gonna fucking love them. So yeah, it's worth it. It's only like 2 minutes. It's good. Anyway, all right. Well, I think we should wrap it up then. We have Convos.
Thanks, Jude.
Take care, everybody.
See you next year.